Hi everyone. Can you see this? Can I see the slides as well, please? Lovely. Thanks everyone. So my name's Gill Farrar. I'm the FP lead and I'm from GE Healthcare, leading the AMYPAD programme with Frederick Barkhoff, who is the academic lead from the VUMC and the University College in London as well. So next slide, please. So our IMI funded programme, it's called AMYPAD, Amyloid Imaging to Prevent Alzheimer's Disease. It consists of 9 academic partners, and we have 3 efpia partners, GE Healthcare, Janssen and Life. We have a patient organisation, Alzheimer Europe. They expertly do our communications and our beautiful website, as well as 2 SMEs. Ixico, they help with image processing. And obviously, last but never least, Synapse, and they do our project management and our interactions with IMI. And this is a 6-year programme, and we're in year 5, and we'll end in September 2022. So next slide, please. Hoping the next slide is going to, here we go. So our consortium, amyloid, we're examining closely the deposition of the pathology protein called amyloid, and if you can see on the top right, you can see the protein deposits seen under the microscope, and they're gradually deposited and they lead to dementia. And in the top left hand side, you can see the time course, and that covers many years of protein buildup, which occurs actually many years before the onset of cognitive decline. And at the bottom, this basically is the fundamental methodology for our AMYPAD programme. We have 2 tracers, one from Life and one from GE, Neurosec on the left-hand side and Vizamyl on the right-hand side. And basically, these are molecules that are radio-labelled, and we basically we image people. You can see the camera on the left-hand side, and then on the right-hand side at the bottom, we basically do either a visual analysis or a quantitative analysis of the brain, of the amyloid deposits in the brain. So next slide. So I'm sure everyone's aware of the recent approval of the Biogen drug ADDI, and that was approved last week via an accelerated approval route that was actually linked to the reduction of amyloid beta plaques, and that's actually using the imaging technology, which is integral to our AMYPAD program, and that's the technology that we've been studying for the last 5 years. And you can see on the left-hand side, the brain, which says baseline amyloid PET with the red signal. This is the high amount of amyloid at the front of the brain, and basically how this decreases after the presence of the treatment in the follow-up period. So this is the scan after the treatment has been performed. So this is basically as I say, the fundamental technology that Biogen got their approval based for. So if we go to the next slide, let's have a look at the AMYPAD programme. So we've got 2 studies covering nearly 2,000 subjects, and where we're imaging the presence of this protein. So the first study on the left-hand side, we've got a diagnostic study where we're examining the influence of the PET scan, how that influences the diagnosis, the confidence in diagnosis, and also patient management. And then the second study on the right-hand side, we've got a prognostic study. This is a natural history study where we're understanding the evolution of amyloid deposition in the brain, and we're capturing earlier subjects who may be developing the pathology. So it's a wide range of subjects in the Alzheimer's disease continuum that we're actually studying in our AMYPAD consortium. So if we go to the next slide. So basically, the presentation today, it's very much focused to IMI. It's focused on what AMYPAD has delivered, both in terms of creating new evidence to move the dementia field forward, but also for the body of data and images that hopefully other people will access for their own research work. These are the assets that Carlos was referring to in his NEURONET talk. So you can see, for example, in the DPMS study, we're going to have a lot of PET images. There will be a lot of patient diaries, which were basically being collected over 0, 3, 6, and 13 months. There'll also be clinical evaluations. And on the right-hand side, in our prognostic study, We've got a number of unique scans, subject scans. We'll have baseline follow-up scans, but we're also importantly working with other cohorts in Europe to sort of include their baseline scans and also trying to do follow-up scans on these other cohorts. So we're hoping overall in the prognostic study to have over 2,200 images plus the image data set that we'll have from our diagnostic study as well. So we go to the next slide. One benefit of working in AMYPAD is that we've created a large network across Europe. These are partners who are they're skilled in imaging, both in imaging and diagnosing patients, but also skilled in performing research studies in the early stages of dementia, where we hope that future therapies will be effective. You can see on the left-hand side that we're happy to report that AMYPAD, we've formed good collaborations with other consortiums in Europe, EPAD, EMIF, DELCODE, for example, efpia, PSABI, and basically hoping that we'll join forces to create an even wider body of data and images that will form the asset that will be so important for future work. If we go to the next slide. I mentioned earlier the clinical study, the diagnostic study, which is now finished recruiting, but what it's doing at the minute, it's actually following up patients. And this study is looking at the impact of the amyloid PET scan on the time to diagnosis and the confidence of the diagnosis. What we've done is actually we've worked very closely with the European Medicines Agency, EMA, to basically design the strongest possible study. And that actually includes a randomization phase to try and avoid any bias. So if you look at the design of the study, we basically have patients coming in with cognitive complaints. They get split up into 3 groups, which have subjective cognitive decline, mild cognitive impairment, or Alzheimer's disease. So we've sort of split them up into the stages of the AD continuum. And then they get randomized. And this is the piece of work that actually avoids the bias, so that those subjects then go into 3 separate arms, one where the scan is performed very early, one where the scan is performed much later in the diagnostic workup, and then a 3rd arm where the physician gets to make a choice. So if we go to the next slide, we'll actually look at the value add. So basically the study is not of value not only to assess how the PET scan helps the physician with his diagnosis, but also to assess the cost benefit of the scan. And we know this is very important from a payer perspective. So over the course of the study, where these patients are being followed, patients primarily in the study for about a 1-year period, they fill in a number of diaries, and these diaries capture such items as hospital admissions, medication use, visits to the GP, etc. And then the aim of the diary analysis, that will be to basically look at the overall costs associated with these items and to see if those subjects who have an early scan show any cost benefit if their diagnosis is made at an earlier point in their patient workup. So next slide. So we've discussed some stuff on the design of the studies. We've actually got some early results that we can share with you. So number one, if you look at the diagnostic study here and you look at the bar charts below, we can see in the diagnostic study that there are 2 distinct populations. The population on the right-hand side is basically those that have a positive amyloid scan, and the population on the left-hand side are those that have a negative amyloid scan. Whereas in the prognostic study, again, we have a slightly different sort of profile of subjects going into the study, and what we're looking for is this early population. You can see that there's a sort of, we've got the negative patients on the left hand side, there's a few positive subjects on the right hand side, but there's also that patient population that we're actually interested in. You can see it's in a blue curve, and those are the people that we believe are developing amyloid. So those subjects will be of great interest in understanding the factors that contribute to the progression of the pathology, but also cognitive decline as well. So those are just some early results that are coming out of both of our AMYPAD studies. So if we go to, just got a few more outputs that we've performed that we're very proud of in our AMYPAD program. One important result is the consortium. We've got a deep knowledge and understanding of the methodology to accurately measure the amount of amyloid in the brain. And you saw in the ADDI approval slide that the new drug reduces the amount of amyloid in the brain. And I think the ability to perform this measurement with precision, I think that will actually form an important component of how this new drug is used in the future. And you can see in the diagram that I'm showing you on the slide, there's 5 different PET scans, and they've got each different levels of amyloid. And underneath, basically, is the method of analysis. This is called the centiloid analysis, for example, and that fits the amyloid burden into a 0 to 100 scale. So what we're doing critically in our AMYPAD program is we're making a very, very deep assessment of the current quantitative methodologies for the future use of amyloid PET for the purposes of diagnosing patients, to put them on the therapy and potentially monitoring them. Next slide, please. Also, we've got a software program that's available to all researchers. So if you're interested to process scans, we've got this software program called NiftyPET, where multiple images can be processed, and these quantitative measures that I showed you in the previous slide can be made. And this software, it's been largely developed by Pavel Markovits on the right-hand side at University College London. So again, if anybody's interested, please connect with me and I can put you in touch with him. So just a few more outputs, key outputs. Number 8, we go to the next slide. So one key element of any IMI program is basically the production of high quality publications in top tier journals. I've just produced a great example. This is a publication that was put together by Ludwig College and Fiona Heeman from the VUMC in Amsterdam, where they basically analysed over 3,000 amyloid PET scans to try and understand and develop a pattern of where amyloid is expected to start to be deposited in the brain, how that amyloid starts to progress over time, and how that progress is linked to cognitive decline. You can see some graphs on the right that actually show some predictive mini mental state score decline, and that was related to the amyloid stages that Fiona and Ludwig developed for this neurology publication. So that's one example, and all of our publications are actually on the AMYPAD website that I mentioned earlier. So final few slides, if we go to slide number 9, sustainability for the future. I think it's very important that we have a sustainability program. We have a legacy. We've obviously got assets that are very important, but we also want to provide a legacy to show, you know, the value add that our IMI program brought to the dementia field. What we do hope to do is we aim to join the Gates Ventures. They've started an initiative called the Alzheimer's Disease Data Initiative, and it's a workbench where hopefully people will be able to go with questions, they'll be able to go with future analysis, hopefully they'll be able to go with data of their own and work on this workbench. That is an endeavour that we hope to start to sort of work on in the next well, actually start this summer, but actually go and work on it over the next couple of years. We also want to do some continuity with our cohort as well. That's very important as well. Carlos mentioned basically the neuro cohort, and it's important that we in some way are able to sustain the 2 cohorts, even if it's just to sort of do some basic clinical follow-up. So again, that's an important component for AMYPAD as well. And my final slide is just to say an amazing thank you to all of the people that we work with in our efpia partners, with our academic partners, but also just to let everybody know that it's been a great talent incubator. We've got some great young scientists in AMYPAD. These are going to basically be the next generation of people that will be working on Alzheimer's disease. So good luck to them, and thank you to all of them for their inputs to our AMYPAD program. So thanks very much, Elisabetta. I've finished.